Hello guys, and welcome back to my YouTube channel. And so today we want to talk about diabetes, its symptoms, its causes, its risk factors, and also the treatment and also the dietary management. So basically diabetes is a metabolic disorder that either causes your blood sugars to be higher or below the normal ranges of the required levels, and it is where the hormone insulin isn't, where your body doesn't make insulin, or the insulin being produced by your body is not effectively used in your body. And so there are different types of diabetes. We have type 1 diabetes, or the autoimmune disease. Yeah, this is the type of diabetes that where the immune system attacks the pancreas cells, and and the and this autoimmune disease, only 10% of people have it. It is very rare. We have also type 2 diabetes. In type 2 diabetes, it is when your body becomes resistant to insulin and sugar builds up in your body. And we have pre-diabetes. This is when your blood sugar is higher than the normal, but not high enough for diagnosing type 2 diabetes. Yeah, we have gestational diabetes. It is the high blood sugar during pregnancy, and it is where the insulin blocking hormones produced by the placenta causes this type of diabetes. Yeah, when you are pregnant and your placenta produces an insulin blocking hormone, you will always develop gestational diabetes. And there is also a very rare condition of diabetes known as diabetes insipidus, that is always not related to diabetes mellitus, but it is always similar. Yeah, it is a condition in which your kidneys removes too much fluid from your body. And each type of diabetes that we have talked about, they have different symptoms, different causes, and different treatments. And symptoms of diabetes basically includes you may have a blurry vision, you can't see clearly, you may have extreme fatigue, you are always very tired even when you have not worked for so long, or when you have completely not worked at all. You may have a sore on your heels. Yeah, your heels can become not sensitive to sense that maybe you are injured, and you have frequent urination. There is an increased dust. The way your body loses its fluid, it is also the same way that you will always have that urge to take in more in order to recover the lost fluids from your body. So with frequent urination, you will always have increased thirst, so you take water or fluids more. There is increased hunger. Yeah, you always want to eat everything. Yeah, and symptoms in men, there are symptoms in men that you can sense that they have diabetes, and it is necessary to go to the hospital. In men, the general symptom is decreased sex drive and erectile dysfunction and poor muscle strength. And symptoms in women who have diabetes can have UTIs. Women can also have yeast infections and dry, itchy skin. For type 1 diabetes, symptoms increase an extreme hunger, increased thirst, unintentional weight loss, that is gradual weight loss, frequent urination, blurry vision, and tiredness. Yeah, and it may also result to mood changes or mood swings. For type 2 diabetes, symptoms are like for type 1 diabetes, but then there are sores on your heels, takes too slow to heal, blurry vision. For gestational diabetes, most women with gestational diabetes doesn't have any symptoms. The condition is often detected during a routine blood sugar test or oral glucose tolerance test that is usually performed between 24 and 28 weeks of gestation. In rare cases, a woman with gestational diabetes also experiences thirst and frequent urination. For causes, a type 1 diabetes it has no specific cause for some reason, because the immune system mistakenly attacks and destroys the insulin producing beta cells in the pancreas, and it also may be genetic. It is also possible that the virus sets off the immune system attack. For type 2 diabetes, the is being overweight or obese increases your risk too, and carrying extra weight, especially in your around your belly area, makes your cells more resistant to the effects of insulin on your blood sugar. And these conditions can learn in genes, and family members may share the genetic condition that it is more likely to get type 2 diabetes and to be overweight. For gestational diabetes, it is the result of hormonal changes during pregnancy, where the placenta may produce a hormone that always makes the woman's cells less sensitive to the effects of insulin in your body, and may cause a high blood sugar during pregnancy. And also women who are overweight when they get pregnant, or who always gains too much weight during their pregnancy, are more likely to have gestational diabetes. For diabetes risk factors, there are being an overweight person, 45 years and older people, or it may also be genetic. It may also occur to those who are not physically active, and also to those who have pre-diabetes, and to those who have high cholesterol levels, high blood pressure, or high triglycerides. And also it can occur to those who had gestational diabetes when they were pregnant. Gestational diabetes is not treated, it can be a type 2 diabetes. For gestational diabetes, risk factors are: maybe you are over the age of 25, you have a polycystic ovary syndrome, and it is also genetic, or have given birth to a baby weighing more than 9 pounds, or you had a gestational diabetes during the last pregnancy. We also have the complications that are brought by diabetes, and they may include the heart disease or heart attack or stroke, basically the cardiovascular illnesses. We have the neuropathy, your nerves are affected. You have nephropathy, your kidneys are affected. You have retinopathy, where your eyes, or you may have a vision loss. You may have a hearing loss. You may have foot damage. Such infections, when you have foot damage, your sores may not heal faster. You may have skin conditions such as bacterial or fungal infections. You may have dementia. You may tend to forget things so faster and so easily, and you may have also depression. For gestational diabetes, complications of the gestational diabetes are mainly the premature birth, jaundice to the babies, low blood sugars, increased risk of type 2 diabetes later in life. You may also have a stillbirth, and you may give birth to a higher than normal weight baby. Mostly to mothers who get gestational diabetes, they may develop preeclampsia or high blood diet. That preeclampsia is the high blood pressure in pregnant women, or type 2 diabetes. They may also develop type 2 diabetes, and they may also require to have a cesarean delivery, commonly known as C-section, and the mothers are at risk of gestational diabetes in future pregnancies also increases. For treatment of diabetes, for type 1 diabetes, there are 4 types of insulin that are commonly used, and they are mainly differentiated maybe by how they quickly work, or how long they last. And we have a rapid acting insulin. We have the long-acting insulin that starts to work a few hours after injection and mainly lasts 24 hours or longer. We have intermediate-acting insulin that starts to work 1 to 2 hours and mainly lasts 12 to 18 hours. We have short-acting insulin that starts to work 30 minutes and lasts 6 to 8 hours. We also have a rapid acting insulin that starts to work 15 minutes and it lasts for 3 to 4 hours. Also for type 2 diabetes, diet and exercise can help to manage it, and lifestyle changes aren't enough to lower your blood sugar, and you need to take medication. And these drugs will always lower your blood sugar levels in a variety of ways, and they will always slow your body's breakdown of sugars and starchy foods, reduce the amount of glucose in your liver that your liver always makes, and change the way your body making it drop too low. It may also change the way your body produces insulin. It may stimulate the pancreas to release more insulin and release more glucose into the urine, and it also stimulates the pancreas to help the insulin to work better. We also have the dietary management of diabetes, and for type 1 diabetes, your blood sugar levels rises or falls based on the types of foods you eat. So for starchy and sugary foods, make your blood sugars to rise rapidly. Protein and fat cause more gradual increases, and your medical team may recommend to limit the amount of carbohydrates. You will also need to balance your carbohydrate intake with your insulin doses. Yeah, so when you are managing your diabetes nutritionally, you also make sure that you take your drugs. Don't skip your drugs, and you will need to work with a nutritionist or a dietitian who can help you design a diabetes meal plan and get the right balance of proteins, fat, and carbohydrates that can help to control your blood sugars. For type 2 diabetes, eating the right types of food can both control your blood sugars and may also help you lose any excess weight, and carbohydrate counting is an important part of eating for type 2 diabetes. And with your dietitian, they will always help you to figure out how many grams of carbohydrates to eat at each meal in order to keep your blood sugars levels steady, and try to eat small meals throughout the day. Yeah, and you should eat healthy foods like whole grains, vegetables, lean proteins. For lean proteins, we talk of poultry and fish. For healthy fats, we talk of nuts and olive oil. You should also take fruits, and certain other foods can undermine efforts that keep your blood sugar in control. For gestational diabetes, always eat a well-balanced diet. It is important for you and your baby during the 9 months. Making the right food choices may also help you to avoid diabetes medications. You should always watch your portions of food that you eat in one sitting, and limit salty or sugary foods, and you may also avoid eating too much, and consider making an eating plan with your nutritionist or your dietitian, and in order to ensure that your diet has the right mixture of macronutrients. In order to diagnose for prediabetes or diabetes, there are two tests done. There is the fasting plasma glucose, or mainly known as FPG test, that measures your blood sugar after you've fasted for 8 hours, and there is the A1C test that provides how your blood sugar levels are over the last 3 months. And in order to diagnose the gestational diabetes, your doctor will always test your blood sugar levels between your between the second trimester, yeah, from the 24th week to the 28th week of your pregnancy. And during the glucose test, your blood sugar is checked after an hour after you drink a sugary liquid, and during the 3-hour glucose tolerance test, your blood sugar is always checked after you fast overnight and then drink a sugary liquid. For prevention, diabetes can always be prevented, yeah, and it is because it is caused by a problem with the immune system, and you should always get at least 150 minutes per week or 30 minutes per day to do an exercise such as walking or cycling. Make sure you sweat to burn the excess fat in your body, and you should just remove saturated or trans fats from your diet, and along with refined carbohydrates, just go for whole grains and eat more fruits and vegetables and whole grain foods. Eat smaller portions of food and try to lose your body weight if you are overweight or obese. For those people who always have problem in managing their diet or don't know what to eat when they are diabetic, we have diabetic plate model. We'll see it. Yeah. It consists of half of your plate always consists of vegetables. Yeah, you can have your green vegetables. Quarter of your plate are carbohydrate. The other quarter of your plate are always proteins, and you should take water at least 8 glasses per day. When you say 8 glasses per day, it is so hard for person to just sit at one sitting that you take the 8 glasses of water per day. You may plan as well. You say after an hour I will take a glass, yeah, until the 8 glasses are finished or are full. It will prevent a lot of diseases. We have also diabetes in children. Yeah, children can also get both type 1 and type 2 diabetes, and controlling the blood sugar in children is quite hard, and because the disease can damage some very vital organs of your body like the heart and the kidneys. And for type 1 diabetes in children, it is always autoimmune form of diabetes and start in childhood. And one of the main symptoms you can note with your child is frequent or increased urination, and those children may start wetting their bed. Yeah, maybe after they have been trained, they may still wet their bed. They may have hunger. Yeah, they may want to eat each and every time. They may have fatigue. Maybe they don't want to play with their friends, and it can also lead to high blood sugar and dehydration, which are always very, very medical emergency cases. For type 2 diabetes in children, it is always called the juvenile diabetes because type 2 is so rare in children. Now that children are overweight and obese, type 2 diabetes is just becoming most common in this age group. And children with type 2 diabetes don't have symptoms, and the disease can only be diagnosed during a physical exam. And if untreated, type 2 diabetes in children can cause a lifelong complications that can affect their vital organs like the eyes, the heart, and the kidneys. With healthy eating and exercise can always help your child manage their blood sugars and prevent these problems, or prevent their vital organs from being damaged. Yeah. And for type 2 diabetes, it is more prevalent even in younger people than in older people. On diabetes, also we have the diabetic foot care. Yeah, you should always wash and dry your feet daily, and you should use a mild soaps with clean warm water. And you should not rub thoroughly your feet. After washing, just apply a petroleum jelly on them to prevent cracking, but not between your toes. This can lead to an infection. Yeah? And also make sure that you check your feet every day. Look carefully at the tops and bottoms of your feet, or use a mirror, or have someone else to do it for you. And maybe use you to check for dry or cracked skin on your feet or toe or heels, and check between your toes in order to to look for cuts or fungus that might cause athlete's foot, and check for maybe increased warmth or tenderness when you touch an area in your foot. Always take care of your toenails. Yeah, maybe when after bathing, that's when they are soft, that's when you should cut them. Trim them straight across, and you always don't cut the cuticles. Yeah, and don't use anything sharp to clean under your toenails or to remove the calluses. Yeah, and also always be careful when exercising. Exercise regularly to keep your blood health flow well, but also be very keen, and in order to prevent sores. Yeah, don't exercise when you are barefooted. Protect your feet with shoes and socks. Never go by barefoot or only in socks. You don't have to step on rocks, tucks. Yeah, to prevent cuttings. You remember when you are diabetic, many people tend to lose their sensitivity on their lower limbs, so you not know when you are being cut. Yeah, that's why it is always necessary to check on your foot, and don't wear tightening shoes. Always wear a shoe that fits you well. Yeah, that's not too much tight to you. When you have a diabetic foot, there are danger signs that requires you to see your doctor immediately. That includes maybe the dampness or pain in your legs, the ingrown toenails, you have blackening of the skin, you have hamatoes. Hamatoes are when the middle joint of your toes are permanently bent downward. And lastly, please observe COVID rules. COVID is real, guys. Be safe and save your friend. Thank you for listening. Thank you for watching. Please subscribe, share, and comment. Thank you, and God bless you so much.